Why, thank you very much, and welcome everybody to today's program where we're going to talk about the CMS hospital conditions of participation that affect medical record services, or as most of us call it in healthcare, the Health Information Management Department, but it also affects, of course, everybody and how they comply with the medical record standards. And on slide number 2, I always give you my phone number, and if you have any questions, you can give me a call. I don't generally accept emails because sometimes I don't get them or I don't understand them, but if you call me, I am happy to help. Also, when I come to the section on the new federal law on substance use disorder, if you would like to have a detailed set of slides, what you have to do is call me and then tell me you've sent me an email so I can look for it, and then I can send them to you free. Also, today we're going to be talking about the hospital standards. If you are in a system with a critical access hospital, the standards are usually for this one are the same or a slightly shortened version. The only thing is you have different tag numbers. So if you would like to have the section on medical records for critical access hospitals that, like I said, it's pretty much the same, but the tag numbers are different, follow the same process. I have office hours from 10 to 10 p. Eastern Standard Time from Monday through Thursday. Please don't call me early and wake up my family. You'll make me very unpopular. And I do usually get done teaching by 5 or 5:30 every night, and I'm sitting in my office working. And if you have a question, you're very likely to find me just picking up the phone and being able to talk to you. Also, this is cool. CMS now has an email address that you can email directly to them and get it in writing. I have used this over 32 times. It is wonderful. So on the bottom of slide 2, it's hospitals@cms.hhs.gov. We have a few objectives for today, and in the 525-page manual, we call the conditions of participation for hospitals. And if you accept Medicare and Medicaid, you have to follow these for all patients. There is a chapter or a section on which they call medical record services. And then we're going to talk about when an H&P has to be done under tag 305 and 320. We're also going to talk about the CMS verbal orders under tag 454 in medical records, and Joint Commission has a similar standard. And also there's a tag 407 and 408 in nursing, which kind of duplicate verbal orders and why that is still kind of a hot topic. And then we're going to talk about that CMS has a standard on pre-printed orders, standing orders, and protocols. And the new section was actually added to the medical records section, tag 457. There's actually 4 tag numbers, but the primary section is in 457. And 2 of them, 450 and 457, are in medical records, and 405 and 406 are actually in the nursing section, but I'll tell you what you need to know. And we get a lot of questions about standing orders and protocols. And in fact, the company that's doing this today is going to be putting that program on. I think it's next month. So we'll hope you can join us for standing orders, order sets, protocols, and pre-printed orders. And this is what we call a deep dive series, meaning we take a part of the CMS hospital manual and we go into it in detail. We also call it a survey readiness program because we don't want you to get one of these. This is a bad thing to get in the mail. It's a statement of deficiency, meaning you flunked and you have to do a plan of correction. Now, the conditions of participation first came out in 1986, and there have been a lot of changes. And today we're also going to talk about what currently is in the section on medical records, and we are going to talk about some significant proposed changes that CMS wants to make in the medical records section. And the section of the manual, if you've ever taken a look at it, it has section numbers or tag numbers. And the medical record section goes from tag 431 to tag 469. And if you ever look at one, I'll show you what a page looks like. But the first thing is CMS will publish it in a proposed regulation, and when it's final, it appears in the Federal Register. And then step 2 is that CMS comes along and adds interpretive guidelines so that we as the hospitals will know what it means and the surveyors will know what it means. And then some of them have a survey procedure